ignorant or have the illusion of knowledge. Let's have a conversation with them. So I call up the chair of the British Medical Association. And I was in America at the time. I'd come, because I live alone now, right? So I lost all my family, and my closest family are in California. And they said, Aseem, just come and spend a couple of months with us. So I get to the States around the end of November 2021. And the first thing that happens is I get an email from a very prestigious medical body I'm associated with. I won't name them. And they say, Dr. Malhotra, we've received a number of anonymous complaints from doctors that you are spreading anti-vax disinformation. Purely upon that interview on GB News where I said there's a signal, we need to look into it. That's all I did. So I was like, Jesus, really? And it was obviously stressful. I had to respond, and it took a month, and they left me with a warning at that point. But I realized something else was going on here. So I called up the chair of the BMA. His name's Chand Nagpal. And I said, Chand, I need to talk to you. And he listened for 2 hours. I talked him through every bit of data that I'd come across and things about the vaccine. He said, Aseem, he said, I'll be honest with you. He said, nobody I've spoken to in health policy, my colleagues, appears to have critically appraised the evidence as well as you have. Most of them are getting their information on the benefits and harms of the vaccine from the BBC.
Wow.
Now, that is replicated. If you remember, Joe, Rochelle Walensky, a former chair of the CDC, she said in an interview, former director of CDC, that her optimism from the vaccine came from CNN. Right? And that CNN news report, right, that she was referring to, Joe, was almost verbatim a reproduction of Pfizer's own press release.
Wow. That's some great journalism.
Well, it tells you something else. I think that we shouldn't underestimate the impact of the mainstream media in influencing people's decision-making, even people who you think should have better information or know better.
Right.
Right? And that, that's what it showed. So he said, listen, okay, Aseem, I'm with you. The medical royal colleges and the BMA anyway didn't support mandates. They were kind of silent about it. They weren't proactive. I was probably there was a few campaigning doctors in the UK and an organization called Together Declaration that got involved in it. And I went on the full offensive, through social media, through mainstream media, and said, we need to get this overturned. I had people, nurses and doctors, who almost in tears contacted me who were unvaccinated. And I said, listen, hold firm. They passed this in Parliament. Most of the MPs voted for it. It was going to be in legislation. And I said, hold fire. This is not going to happen. Do not get vaccinated if you don't want to get vaccinated. And literally last minute, like a week before this was going to come into effect where people would lose their jobs, the chair of the BMA was speaking to Sajid Javid after speaking to me and all these people campaigning, and we got it overturned.
Wow.
And, for me, one of the most satisfying things I've been involved with is helping to save, in effect, these tens of thousands of jobs in the NHS, especially because it wasn't scientific, it wasn't ethical to do so.
And because it wasn't scientific, and because there was now evidence that it didn't stop transmission and it probably wasn't going to stop infection, what was the narrative that you were given as to why this should still be promoted?
Well, there wasn't really anything, Joe. It didn't make any sense to me. The chief medical officer was still saying the same thing, though. So he was still tweeting out, even before they decided they were going to, and even after they overturned this mandate decision for healthcare workers, he was tweeting out, the best thing you can do as a doctor to protect your patients is get vaccinated with the COVID vaccine.
Yeah.
It didn't make any sense. It was almost like, to be honest, this was the kind of narrative that was coming out was essentially the narrative of the drug companies, but coming through so-called credible voices. It wasn't in keeping with the evidence. It didn't make any sense. So yes, then I decided at that point I'd started to really critically appraise the data properly, and I thought, there's a big mountain to move here. It's not an easy one. I've just gone on TV and questioned about heart side effects, and suddenly one of these medical bodies I'm affiliated with is coming after me. So I thought, you know what, I'm going to do my best to, what can I do here? Historically, Joe, over the last 10 years, I've published a lot in different medical journals. And I only write stuff which I think is important, disseminating the truth, something I believe is important for the public and for patients and even for doctors. And almost every time I've published something, and I kind of became good at this, is I've got it into the mainstream news, whether it's about, the harms of excess sugar or the statin thing or cholesterol or low carb diets or whatever, or the harms potentially of vegan diets, right? I've done lots of these things. And I thought, let me try and publish this in a medical journal. And I thought carefully, like it wouldn't be easy to publish something like this, even if what I'm saying is factually correct. So I went to a journal called the Journal of Insulin Resistance, not well known, but it's a credible journal. And I spoke to the editor. Often you just say, listen, is this something you're interested in? What do you think? They'll say, no, Aseem, just forget it. And she was very open, right? And she was very pro-vax, actually, at the time. She was a bit shocked with what I was telling her. But she respects me. She knows my work over a number of years. Said, listen, Aseem, let me look at it, and I can at least say that I'll send it for a peer review, right? There's no guarantees of anything, but I can send it for a peer review. So send me what you've got. So I spent several months. I wrote this piece, Joe. It was 10,000 words. That was the other thing. Most journals wouldn't accept that many words. And I'd written that, and it was in 2 parts because I thought people have been so indoctrinated with this narrative. I need to walk them through it as someone who was vaccinated, who went on Good Morning Britain, right? I'm one of you. I'm not, it'd be less easy to attack me. And to walk them through my journey in understanding how the new data had emerged that made us think differently about what we were told at the beginning. And to break it down in absolute terms. What are the benefits and what are the harms? My dad's story was included in that. And then the part 2 was how we got it wrong, why we got it wrong, and what are the solutions moving forward. And this journal also doesn't take money from industry, so that's why